Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752. We are here Saturdays at 10 a.m., again at 1 p.m., and Dr. Darrow's website is www.lastemcells.com. That's lastemcells.com. And we were talking a moment ago to Harry, and I think you weren't quite finished giving him information.
Bring me back up to date. To be honest with you, I was working on the microphone here, and I lost my train of conscience.
Yeah, no, he just needed to have all the office information because he's going to call for an appointment.
I remember that.
Yeah.
Sure. The office phone number for all of you and for you, Harry, is 800-300-9300. I'll repeat it for you while you grab your pens. 800-300-9300. And the website where you can watch videos of me doing these procedures is www.lastemcells.com, lastemcells.com. And if you look under resources, or sometimes on the pages of the website, you'll find tons of videos. If you go to YouTube and put my name in, Marc Darrow, MD, you'll find a lot more videos, and it's very educational. You can see exactly what I am doing and whether you think it's something appropriate for you. And to let the new listeners know what I'm doing, I do what's called regenerative medicine. That means that we are regenerating the tissue in the body. And Harry was talking about regenerating the tissue in his face, and he was using the vampire facial. It's a great name. Using microneedling and taking his blood and putting it on top. We can do that, but we also use what's called the vampire facelift. Everybody's probably laughing at these terms, but they're great terms. No one forgets them. It was trademarked by a doctor in Alabama years ago. And what we do is we take the blood, we spin it, take the platelets out, and we can also add stem cells to that if you like. And it is to inject into the face and thicken back up the collagen, because as we get older, we get a little bit more gaunt looking. The fat disappears, the collagen disappears, and we look older. That's aging. So we can rejuvenate the face that way, just like I rejuvenate the body, the musculoskeletal system, the orthopedic system from pain and sports injuries, arthritis, and all that. My wife, Michelle Darrow, takes care of the face and the top of the head to grow back hair.
Sounds good. So our number is 866-870-5752. We want to hear from you about your musculoskeletal pain. That's muscle pain, joint pain, tendon pain, disc pain, back pain. You might have body pain and you might not even know what it is. So maybe you could call and get a clarification from Dr. Darrow today. That's 866-870-5752. And you can also see a lot of research and information in the videos that Dr. Darrow just mentioned a few minutes ago by going to www.lastemcells.com. That's lastemcells.com. And if you are ready to just call the office, make your appointment, 800-300-9300 is that number, 800-300-9300. You do get a free book today when you call the program. Dr. Darrow's latest is called Stem Cell and Platelet Therapy. Subtitle, Regenerate, Don't Operate. That's quite a phrase. You might talk about that.
It pretty much, it says it all. First of all, I love Suzanne Summers, and she wrote the foreword to the book, and I have a beautiful picture of her in it. She is an amazing, amazing person. She is a light to the medical community because she is open-minded and she gets out there and takes her time to travel around to different medical conventions speaking about the problems that come up using traditional medicine and the safety net that we have using what's called alternative medicine. And don't get me wrong, to me, traditional medicine is alternative, because we on this planet have been using what the public calls alternative medicine since the beginning of time. It's natural healing. Why are we switching over to high tech? It makes no sense to me. There's so many dangers. The number 3 cause of death in our country is medically induced problems. That's called iatrogenic. Good word for you to learn, Nita.
Oh, I know this
like
word. No, you taught me this word. I should mention that we're now on the air together over 10 years.
My gosh.
You taught me this word like probably 15 years ago, even before we were on the air together. So, yes, and the research absolutely speaks for itself on that. You're absolutely correct.
I thought the word I taught you was enthesopathy.
You taught me more than one word. I mean, come on, 10 years. I've learned so much from you. Come on. I could practically do those shots. Not really. I'm not that kind of doctor. So, but yes, this is a treatment that worked on you, worked on me.
Worked on you too, yeah.
That's right. That's right. Should we go to Vivian?
Vivian, how are you today? Dr. Marc Darrow. The name of the ophthalmologist that I mentioned is Howard Krauss, Krauss. He's one of the most brilliant people on the planet. Any questions, Vivian?
Hello?
Yeah. Do you have any other questions?
No, I want the doctor's name and the phone number.
You'll have to email me through the website, and I'll give it to you. I can't right now. But if you go to the website, which is www.lastemcells.com, you can email me from any page, and I'll send you whatever information you like. Okay?
Okay. Thank you
God
so
bless,
much.
honey. Yeah.
Thank you.
So we mentioned the term enthesopathy.
Yes.
And it's actually, I think it's Nita's favorite word.
I think it is. And
I think so.
Yeah, and it has to do with...
Because whenever we go to cocktail parties together, you always mention that word.
That's hilarious.
You use it to kind of break the ice. You walk up to handsome men and go, do you know what an enthesopathy is?
Actually, I hadn't done that, but, it's not a bad idea, although my present boyfriend might think I was flirting. That's another conversation.
Well, no, it's medicine. It's okay. Anyway, let's get to a question that came in on Tuesday.
Well, wait. We got to tell them what an enthesopathy is.
That's right. That's why I'm going to this question.
Oh, okay, good.
So this person says, I am struggling with severe back pain and have had an MRI that diagnosed mild degenerative disc disease with posterior annular fissure and broad-based posterior disc protrusion to the left, causing bilateral subarticular recess stenosis and mild central canal stenosis. All this at L4-5. That's the clinical. All I know is severely pinching a nerve and nothing is helping reduce pain. I've gone from very active to severe pain whenever I do anything. Sitting is worse, but I also cannot do anything aerobic. Ongoing muscle spasms. I'm currently doing chiropractic and acupuncture with limited short-term relief, but nothing that lasts till the next day. Very interested in the procedures you do of PRP and stem cells, and I've looked at your website, and I would love you to respond. I do not want back surgery. So what does enthesopathy mean? It means a certain part of the body where tendons, ligaments, and muscles attach to bone. That is called the enthesis. When it's irritated, that's called an enthesopathy. So, for this patient, I'm not going to say your name, don't be worried, we have rights of privacy here. But for this person, who's a potential patient, I should say, most likely you have an enthesopathy. Most likely, there is nothing wrong with you other than the ligaments that attach to the pelvis are sprained, just like a sprained ankle. We don't get surgery for sprained ankles, and for most back pain, we should not be getting surgery. Excuse me. I have nothing against the surgeons. I love them. They do the toughest work in medicine. but it's overdone, and it's done when it doesn't need to be done. I have patients come in all the time who say they're ready for a back surgery, and I see these type of MRIs that have all kinds of things listed. I touch their back and I say, we can heal you with simple injections. And they go, how's that possible? Look at my MRI. And I go, I looked at it. It has nothing to do with where your pain is. How can that be? If we do an experiment and we're in a room with 1,000 people and we say, raise your hand if you do not have back pain, and we get, let's say, 100 people, and we do an MRI of their back, guess what we're going to see? All kinds of pathology, but they don't have pain. How does that happen? The MRIs are big liars, that's how. They show things, but that doesn't mean that thing is generating any pain. So please think about that. You don't go into surgery because of an MRI. Most surgeons that I know of do not examine the body before a surgery. They look at an MRI or an X-ray. How do I know that? Because my patients who come in with failed surgeries tell me that. I ask, does the doctor touch your body? No. Why would they want to? They saw the MRI and showed it to me. Do you get it?
Absolutely.
Anyway, that's an enthesopathy in most cases.
Well, I remember when I first went to you, which has got to be like 16 years ago, the first thing you did was touch the area that was in pain, which happened to be neck and shoulder for me. So I didn't know the source of the pain, but you figured out the source in like 2 seconds. Using touch.
That's usually, touch is all it usually takes. It's the same kind of medicine that my grandfather, who was born around 1850, practiced. They didn't have all the fancy diagnostics. They had to do an examination. And we're taught in medical school to do it, but I just don't see doctors doing it. They're in a rush. So they get the MRI, they get the X-ray, they get the CT scan, then they make a diagnosis based on that when it's not the right diagnosis. I'm not saying the person doesn't have that stuff. I'm saying it's irrelevant. Not all the time, just most of the time.
And our number, we have a few minutes left for you to call in, 866-870-5752. That's 866-870-5752. I bet you have another question there.
Another? I have thousands. This one came in yesterday, and it says ankle. So let's see what's up with this person. Hi there. That's a nice way to say hi. I fractured my left tibia and fibula. Those are the leg bones. That's below the knee, with dislocation back in 1986 when I was 26. From x-rays in the past decade, I was told I have end-stage arthritis in that ankle. Now, give me a break. I hear that every single day from patients. The doctor told me I have end-stage arthritis. Nita, do you know what end-stage arthritis really means? I want you to dig deep underneath the covers.
I think it's a horrible term. It makes people feel hopeless. And I think it really means...
What does it guide them to do?
Nothing. It guides them to do
them
nothing.
To have a surgery.
Or more pain meds or opioids.
Yeah.
Heaven forbid.
The point is, I do a lot of chuckling with patients because I hear these kind of things. It's bone on bone. My life is over. It's end-stage arthritis. My life is over. I examine them and I chuckle and I go, guess what? You've got a good ankle. You've got a good knee. You've got a good back. And they go, how could that be? Because the MRI or your doctor is wrong. The person goes on to say that ankle is always somewhat swollen, and I have very limited plantar flexion that's pushing the foot down, especially, but have been able to this is cool, but I've been able to dance, ride my bike, and walk. Now, is that end-stage arthritis?
Doesn't
Give me a
sound
break.
like it.
No, it's not. Now, the x-ray might show that, but that doesn't mean anything. The person is doing well. Recently, I've been having more pain and just found you on the internet. I'm wondering if I might be a candidate for your therapies. I live in the San Francisco Bay Area, of course. I'm also curious about the cost, but would very much like to keep functionality in my ankle. I look forward to hearing from you. I do not want an ankle replacement. Thank you very much. So yeah, this is a person who would be an excellent candidate for PRP or PRP and stem cells. I do have to do the examination first to confirm that, but for someone who's active like this, no big deal. It already tells me they're doing great.
Which is how you coined our phrase of what the show is about, which is we take the surgery out of pain.
Yeah. Why do you want to do a surgery when it hurts so many people? And please call in. We have another couple minutes left. We're going to get you a free copy of my book. And in the book, there are about 250 studies that show you not to do surgery. The results are not that great. You know, many, many years ago, close to 20 years ago, when I first started the show, we had a surgeon on the show who was a neurosurgeon. And we asked him point blank, we said, what's the percentage of success on your back surgeries? And he said, it's less than 50%. I said, it's less than 50% and you keep doing them? And he said, the patients force me to. They have nothing else they can do. He didn't know about regenerative medicine. There's a lot you can do. But he was not a proponent of surgery. It's just that's all he knew how to do. He would have the family come in with the patient at least 3 times before a surgery to try to talk them out of it. But he had nothing else he could tell them to do. Today, we know about stem cells. We know about PRP. Why these doctors are not learning it, I have no idea.
Very strange. Our number is 866-870-5752. We have time for a couple more of you. That's 866-870-5752. And remember, you can check out Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. And remember, you do get a free book when you phone the program today. Stem Cell and Platelet Therapy, Regenerate, Don't Operate. There's actually 264 studies in the book. Scientific studies. That's impressive.
I love it.
And the foreword is written by Suzanne Summers.
What more could you want? It's worth it just to have her.
I know. I have 2 copies.
I got to tell you, that woman is one of the most lovable people on the planet, and she has dedicated her life to helping people. She's gone through it herself with a lot of things, and she got a new book coming out very quickly, very soon. And as a real thrill for me, she's written a chapter about me on platelets and stem cell therapy. So thank you, Suzanne Summers. We love you.
That's totally awesome. 866-870-5752. Do you want to say a word about Ideal Protein again?
Sure. There's a diet that we use in the office. I think it's the best one on the market. It's called Ideal Protein. Everybody loses tons of weight. It's usually about 15 to 20 pounds a month. And then we train you how to eat low glycemic food to keep you skinny after the diet's over. The diet takes the weight off real quick and helps me heal you. The other thing is the vampire facelift. We talked about that at the beginning of the show. My wife, Michelle Darrow, does that. If you take a look at her and you see the amazing beauty she has, you'll want to do it too. She injects her own face.
That's brave. Well, you inject yourself too. You inject your shoulder.
Yeah, but it's not my face. I inject my shoulders and knees or whatever hurts. But I've never injected my face. Luckily, I don't know if you'd say I have a baby face, but we live a long time in my family. My mom made it almost to 102. Unfortunately, my dad died young at 90. And so we look young for a long time.
That's Good genes or good living? What do you think?
I think it's a bit of both. Yeah.
Mm-hmm. I think so too. I can get in one more caller, 866-870-5752, 866-870-5752. Don't be shy. Don't wait and sit on your question and stay in pain. Not good to be in pain.
I have a great question here.
Oh, great. Go ahead.
This came in Thursday. Would a patient with diabetes be a good candidate for PRP or stem cell therapy for knee pain? So a few things about diabetes. There's two main types. One is type 1, that you are at a loss for producing any insulin when the pancreas, the islets of Langerhans, just are destroyed by a disease process. But what we see more commonly is type 2 diabetes, and that's in the case where someone is overeating and their body becomes too big for the amount of insulin they can produce. So that is a self-induced disease called an eating disorder. And we can treat the knee pain whether a person is a type 1 or type 2 diabetes, so that's not a problem. With people with diabetes, we have to be a little bit more careful with sterility because they have a tendency, if it's very advanced, the knee is not generally a problem, but the feet could be, because often people who have diabetes have small vessel disease and they don't heal as quickly in the foot. And people with diabetes should be washing their feet at least twice a day, sometimes 3 times a day, to keep them super clean, because if they get a wound, an ulcer, then it does not heal. A good way to heal it is with hyperbaric oxygen, though. That's an oxygen tank. Oxygen does a lot of healing for people. So yes, no problem with the knee pain, diabetes, and using PRP or stem cells.
Okay, well, let's go to Mike in Studio City.
Let's do it. Mike, Dr. Marc Darrow, you're an ex-college athlete and you have pain in your upper back and your finger. So let's talk about that. How long has your back hurt you for?
Well, it's been some years, maybe like 4 or 5 years or so, that I've been seeing doctors.
Okay.
And as you just mentioned, I've just been getting, advice, for other types of therapy, physical therapy, and internal medicines. But the doctors are, refraining from surgery. I believe I need surgery. I'm not sure, because I'm only a student, and I don't know if, the conditions to where, it's absolutely necessary. I feel that it is, because, I'm in pain often, but I have so many injuries, and I haven't really been able to get, any assistance other than medication.
Okay.
And I'm sure that there's, some sort of surgical.
You're going to have to email me at www.lastemcells.com. You can do that now, and I will email you right back. I have a lot of good information for you, and you're probably going to heal up very well.
Thank you for your call, Mike. Thank you all for listening and participating. Thank you, Alex and Nick. Remember to listen to The Pet Show with our friend Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens, and we'll see you next time.